Hello students, my name is Alex Buschelb. Starting the year of 2010, I was an average student at MTS working toward getting my grade 12 diploma. I was excited about finishing high school and entering a new phase of my life by going on with post-secondary education. I had also been accepted into the military and had just started training for the Armored Division. I was about to get my G2 after finishing my Traverse training course when, on February 13, 2010, I had a life-changing experience. That night, I went to my high school semi-formal dance. It was a lot of fun. After the dance, I went to my friend's house. He was having a party and I was having a good time with my girlfriend of the time, Leanna, and a bunch of my friends who also went to the party. Later that night, I went down to the basement stairs. As I went down the stairs, I fell because there was no railing for me to hold on to prevent the fall, and also the stairs were too narrow. I tumbled a long way down, and when I stopped at the bottom, I had damaged my head very badly. When my friends found me, I was unconscious. Leanna had training from being a lifeguard, so she opened my eyelids, and because of how my pupils looked, she knew I was in trouble. Thankfully, my friends did the right thing and they immediately phoned for an ambulance. I was rushed to the hospital. There they performed surgery and removed a section of my skull in order to release the pressure that had built up around my brain from all the blood. The surgery was serious and critical to my life. After the surgery, I was taken to ICU, which stands for Intensive Care Unit. I was hooked up to a ventilator to help me breathe, and I was in a coma for several days. My face was so swollen that even my own family had a difficult time recognizing me. The doctors say I'm a walking miracle. After 6 weeks at University Hospital, I was transferred to Parkwood Hospital. When I arrived there, I had a feeding tube because I could not eat, and that feeding tube stayed in my stomach for many more weeks until I was finally able to eat on my own. I also could not speak or walk, and I was very disorientated and could not remember what had happened to me. By the end of May, Parkwood Hospital wanted to transfer me to the NRC, which stands for the Neurobehavioral Rehabilitation Center. The NRC is a building located behind this hospital. A patient is often sent there when they have a brain injury that has caused them to be left with a behavioral problem. My behavioral problem was my crying spells. I cried many times a day without reason. A rehab therapist was with me always during my waking hours, and when I was asleep, there was a camera that was directed at me to make sure that I didn't get up and hurt myself. Besides helping me overcome my crying spells, I also had many therapies such as physiotherapy, occupational therapy, and speech therapy. Remember, I had to learn to walk, talk, and basically think again. Physiotherapy had been a weekly event in my life for over 2 years. As a result of my injury, the right side of my body had developed muscle tone where the muscles remain tight because they do not know how to turn off and relax. This has affected my walking and my right arm and hand movement. With physiotherapy, they concentrate on my balance and my walking. At the time, I had to wear a plastic brace to support my right leg that I needed to fit into my shoes. Now I have an electrical brace that stimulates my muscles with electricity and allows me to wear the shoes of my choice. My physical limitations have caused me to get frustrated and depressed at times. Sports such as snowboarding and dirt jumping with bikes that I used to do a lot, I cannot do anymore because of my muscle problems. Occupational therapy helped me with the movement in my right hand. I still am not able to write very well, and therefore use a computer for making notes and doing homework. I also have worked at writing with my left hand, even though I'm right-handed. Getting the right side of my body to function normally again, which is all completely natural for all of you, is something that I continue to work on. Because I had to learn how to speak again, I also had speech therapy. The therapist gave me tongue exercises to do, as well as working on the pronunciation of words and memory exercises. I also worked a lot on understanding what is appropriate for daily conversation. I used to say mean and inappropriate things because my brain had forgotten what was appropriate and what was not. For example, when my grandma came to visit me in the hospital, I called her fat. My family and friends told me to bring out that filter that gets me to stop saying those things, and I'm good now about that. On February 17, 2011, I was discharged from the NRC, 1 year and 4 days after my accident. Do you think my life went back to normal like it was before? Not at all. I still need to work on memory skills. I also have to work on being able to multitask, because as of now I can only focus on one task at a time. I also need a great deal of extra sleep. and I also see a doctor on a regular basis. I take daily medication, and I have Botox injections every 3 months to help reduce my muscle tone. As for school, I've switched around through a few different courses now. At first, I went to Fanshawe for diesel mechanic, but because of my muscle problems, I had to drop out after the first semester. Then, after that, I went into computer programming. That went well for a couple of years, but then it was starting to get very complicated and I wasn't enjoying it much anymore, and after spending 3 years in the course, I dropped out. Now I have started a third and hopefully my final course at Fanshawe, Interactive Media Design, where I learn to develop websites and I do graphic design. I need special accommodations to help me, such as extra time for tests, a note taker and a tutor. My family also supports me when I'm at home. This is my life, not for the next few weeks, but for years while I recover. I know this all seems horrible, but my brain injury has surprisingly taught me some very valuable lessons that I am now thankful for. First of all, who are my true friends? I certainly lost friends because I couldn't do the same things they could do, because they couldn't be bothered with me anymore. But I also had some pretty amazing friends. They came to visit me in the hospital when I couldn't communicate with them, or I would cry throughout their entire visit. They also made posters to inspire me, pushed me around in my wheelchair when I couldn't walk, and talked to me when sometimes it didn't even seem like I was listening. When I was at the NRC, they even had a fundraiser car wash at Loblaws that was organized by Chris Hambidge. They were able to raise up enough money to buy the NRC a PS3 gaming system so that me and the other future patients could use it as a type of exercise to get our hands working better. I'm very grateful for those friends. My brain injury has also helped me to appreciate the many things in my life that I used to take for granted. For example, it has made me extremely grateful for our free healthcare system, the outreach programs, my school, and especially my friends and family. I think we should all be very thankful and grateful for all those wonderful things we have in our lives, and especially for being born in Canada, where we have access to free healthcare. Lastly, I would like to say that the night of the party will always haunt me. I may have fallen down those stairs under normal conditions by just losing my balance, but I had been drinking. Drinking impairs your balance and your judgment. Under these conditions, anyone is more susceptible to serious injury or causing an injury to someone else. I will never know if alcohol was actually a contributor to losing my balance, but being responsible is what that night has taught me. That is my story. I hope you have all learned something from it. I certainly did.